Hi, my name is Christy Ganoe, and I'm a student in Health Nursing Assessment, Nursing 302 at Mount Aloysius College. I'm going to be doing a physical assessment on a 70-year-old female who is otherwise healthy to see what she has to say and what her body shows for each assessment. I will be completing head, neck, and lymphatic system, as well as hair, skin, and nails. Hi, good afternoon. How are you today?
I'm doing pretty good, thank you.
Good. I am a nursing student. I'm going to be doing a physical assessment on you. Is that okay with you?
Yes, ma'am.
Okay, great. The first thing we'll do is start with your head, and then we'll work our way through each system as we go.
Okay.
Okay? As far as your head goes, have you had any recent changes at all to your scalp?
No, just as a little lesion up there. I have to keep scratching off all the time, but it doesn't bleed, so.
Okay, and can you describe that to me, what it feels like? Is it a
Just
bump?
rough. It's a rough area.
Okay.
Rough.
Do you mind if I take a look at it?
Sure. Right here somewhere. I may have scratched most of it off.
At this current time, I cannot palpate any sort of lesion
Okay.
in that area. Have you noticed any more anywhere else?
Not on the scalp, no.
Okay. And generally, how is your scalp? Do you have any problems at all with it? Do you have any history of dandruff or psoriasis or anything like that?
Just some dryness, just dry,
Just some
dry
dry
hair and
dandruff
scalp.
type?
Yeah, well, some of that.
Okay. And as far as it goes with your hair, describe to me what type of hair you have. Is it coarse, fine?
It's fine.
Okay, and
It's kind of dry.
kind of dry.
Yeah.
Do you have to use any excess amount of conditioner or any specialty products on your hair?
Yes.
Or is it just mildly dry?
I do use conditioners. Yes.
Okay, and in the past couple of months, has anything changed with your hair? You've had an abnormal loss of hair or an abnormal growth of hair? Anything like that?
No, I'm fine with
Okay.
that. I've had different lesions removed from my facial area around my neck from sun damage.
Okay. And have you ever had any history of skin cancer?
Yes, I have. I had squamous cell carcinoma on my upper chest.
Okay. Any other issues with your head at all that you can think of? Do you ever have any abnormal pain that
I
you
sometimes get some spasms in my neck.
Okay, well, what about your head? Do you have any abnormal pain in your head?
No, not that I can think of.
Okay.
Except maybe a little pressure in my temple area at times.
Now, do you know, is there anything that you've noticed that triggers that? A certain temperature, certain smell, anything like that?
No, I think fatigue more than anything.
Okay. Have you ever been diagnosed with anything like a migraine syndrome or anything like that?
No, no.
Okay. Now, do you have any tenderness when I press along your face at all?
No.
Okay. Have you ever had any broken facial bones or any facial surgeries?
No. Except for, and I did have some lesions removed.
Okay.
Yes.
Okay, and as far as your skin goes, do you have any other history of skin issues besides the skin cancer that you had removed before? I know, did you have overexposure to the sun when you were younger?
Yes, I did.
Is that what caused it?
Yes.
Okay. Do you have any chronic skin conditions?
Just dryness.
Just dryness. You don't have anything like eczema
No.
or psoriasis or anything like that?
No.
Okay. And about how many glasses of water do you drink a day?
Liquids, I would say maybe 4 to 5.
Okay. And do you feel that you're adequately hydrated? Do you ever find yourself
I feel
feeling
thirsty.
overly thirsty?
I feel pretty thirsty at times. I mean, you know, I do drink a lot.
Do you have any history of diabetes?
No.
Okay. Would you say that your thirst is excessive compared to the amount that you urinate?
No.
Okay. Well, we're going to do a couple of tests with your skin just to check and make sure you're hydrated. I'm going to inspect for any lesions and basically just take a general look to make sure there's nothing abnormal going on.
Okay.
Okay? So the first thing I'm going to do is inspect to see if you have any abnormal areas of the skin. Now I do notice you have what a lot of people call age spots. Is this is
That's
gotten
good.
more since you've gotten older?
Yes. Cropping up.
Okay. And now I'm going to do a test to check for the hydration of your skin. I'm going to pinch a piece of it upward, and if it stays upward or tented, that means that you could use more hydration. If it goes back down, then that means you're adequately hydrated. Okay, so your skin did not stay tented, which means that you are adequately hydrated.
Good.
Now, as far as your neck goes, have you ever had any neck issues?
Some spasms, yeah.
Okay. And in what part of your neck?
Right in here, like, that goes down through these leaders
Okay.
and my back. Especially on this side, the left side.
And you said you have had torticollis before?
Yes.
And did you receive medical treatment for it? Did they have
Yes.
to give you a muscle relaxer, do any other sorts of treatments in order to relieve it?
Yeah, I had chiropractor treatments and also had an injection.
Okay. Currently, this time you don't have any muscle spasms. That's what I was examining for, or any
Okay.
muscle stiffness. Do you feel like your neck is hurting right now at all?
No.
Okay. And I don't notice, while I was doing that, I was also inspecting the skin on your neck just to see if I saw any abnormal lesions, and I do not at this current time. Any other problems with your neck? Could you demonstrate your ability to move it from side to side by tilting your head
Sure.
first to your left, then to your right? And then are you able to bend down towards your chest?
Yes, I do some of these exercises in the water. I go to the Y a couple
Oh,
times
that
a
is
week.
good. Yes, that probably helps to keep your muscles fluid. Do you have any other questions or concerns about your neck? Do you have any problems with sleeping or anything like that that may be caused by neck problems? Have you ever had any previous neck surgeries at all?
No, I have not.
Okay. The next step I'm going to do is check your lymphatic system. What I'm going to do with that, it's actually going to be another kind of inspection of your neck, but I'm going to look to make sure you don't have any swelling in your lymph nodes around your face that could indicate that you currently have an infection. And I'm also going to inspect your trachea and your thyroid gland. Okay? So when I'm doing this, I'm actually checking to see if you have any enlarged lymph nodes. Have you had a recent fever or recent cold or anything that would warrant those to be swollen?
Just sinus type things.
Now, do you have pressure when I push like this?
No, not bad.
Or
No,
what about pressure up here?
that's fine.
Okay. And I don't feel any swollen lymph nodes.
Okay.
Okay, and now I'm just going to check your trachea to make sure that it's midline and make sure there's not any problems going on inside there. Can you swallow?
Yes.
Okay, and do you have any difficulty swallowing at all?
No.
Okay. And next I'm going to check your thyroid to make sure that it is not swollen. That could indicate any unknown thyroid disease. Okay, and that appears to be okay. Have you ever been checked for thyroid disease?
Yes.
Okay,
My family
and
physician.
okay, and you haven't had any problems with that before. Currently, it's not of any issue, but I was just wondering if you'd previously had any issues.
Right.
And you do not currently take thyroid medication, thyroid replacement?
No, ma'am.
No, and you've never had any thyroid surgeries?
No, ma'am.
Okay. Well, last but not least, what we're going to check is your nails. Can you tell me a little bit about your nail health? Do you have strong nails? Do you have any issues with them peeling or splitting
No.
at all?
No, I do not.
Have you ever had any funguses or any type of abnormal growths in your nails at all?
Just my toenails. There's a couple fungal issues with.
Okay.
One,
And have you
two of them.
received treatment for those at all?
Yes.
Okay. Well, let's take a look at your nails. They're strong. I do notice that you do have some ridging in the top, which could be due to a lack of nutrients. But overall, they look very healthy and without any significant issues. This one looks like you may have done something. Did you injure this finger? Did you shut it in a door or anything?
It might have been a while. I don't remember.
Do you ever have any problems with numbness or tingling in your hands or
Yes.
feet at all? And when did you notice that happens?
Well, if I get cold,
Okay.
extremely cold.
So have you noticed a change in the color?
Yes.
So are you familiar with Raynaud's disease?
Yes, I do
and the
have.
cause of that? It does seem similar to that.
Yes.
Have you ever been diagnosed with Raynaud's
Yes.
disease? Okay. And one final thing I'd like to look at is to check and see whether or not you've had a prolonged history of inadequate oxygen in your body.
Okay.
One way you can tell that is by checking the curvature of your fingernails to see if it's abnormal compared to the usual. So what I'm going to have you do is put up your 2 pointed fingers and bend them towards each other. Okay? And then I'm going to take them and touch them together. And what I'm looking for is there's usually a diamond that's supposed to exist between the tops of 2 of your nails, which yours does, which means you have not previously had a problem with hypoxia or lack of oxygen. So it looks like overall you're pretty healthy today.
Okay.
Do you have any questions about your head, neck, lymphatic system, hair, skin, or nails?
I think I'm fine.
Okay, well I really appreciate you taking the time to allow me to assess you and gave me the opportunity to do this for my class.
Okay, you're welcome. Thank you very much.
And that completes this video. Thank you.